Hello, everyone. Thank you for joining us today. I'm Marcia Stedman. I'm president of the Board of Directors of Healthcare for All Washington. And on behalf of the board, I'd like to warmly welcome you to Healthcare for All Washington's 2020 virtual annual membership meeting and program. Whew, what a year 2020 has been. Just as the 2020 legislative session was ending in March, we were preparing to celebrate our legislative wins. But the coronavirus pandemic forced all of us to change our daily routines. Healthcare for All Washington immediately realized that we needed to change our focus on and reach people digitally. In order to do so more effectively, we began several ambitious projects to address our communications infrastructure. I'm especially proud to report to you today that our vigorous and vibrant communications team, now led by D.W. Clark, who previously worked for Como TV, has rebuilt our website, published deep policy-oriented quarterly newsletters, a monthly bulletin, frequent action alerts, and an expanded social media presence. We published 3 op-ed opinion pieces, and our press releases ensured our name and work was reported on in newspapers and TV news around the state. We also produced this beautiful and comprehensive booklet, which we are using in fundraising and outreach. We participated in the Give Big campaign last May. On every metric, Give Big was a tremendously successful campaign for us, and we had a 360% increase in the number of donors from 2019. And in the most important show of our success, we raised 1,110% more in funds than last year. That allowed us to keep staff throughout the summer to support our progress. It was a good boost, and it showed us how the investment of your dollars in Healthcare for All results in real progress. That progress is reflected in our strategic communications. We turned out hundreds of supporters of publicly funded universal healthcare who made public comments about their experiences with healthcare to the Universal Healthcare Work Group at their virtual Zoom meetings. And for those who could not attend online, they submitted written comments to the Washington State Healthcare Authority. 2020 has been a year of tremendous growth for the Healthcare for All Washington, and your support has made that growth possible. As we know, the coronavirus pandemic quickly became an economic crisis and also exposed the problems of an employer-based healthcare system, as well as the inequities of healthcare access. 5 months ago, more than 1.1 million Washingtonians were receiving unemployment benefits, yet hundreds of thousands more were not even working. More than 850,000 people were without health insurance during a pandemic. Now is the right time to make our decades-long struggle for health equity a reality. We must continue working together with our allies in labor, other advocacy and community organizations, such as Healthcare is a Human Right, the healthcare professions, and our healthcare champions and friends of healthcare in the legislature, in order to achieve our shared goal of truly universal healthcare. Speaking of champions and friends in the legislature, I think we have a few of those with us today. We have Senator Patty Kuderer of the 48th Legislative District, Representative Marcus Riccelli of the 3rd Legislative District in Spokane, former Representative Denny Delbo and current member of the Universal Healthcare Work Group is joining us from Spokane as well. Representative Tina Orwell of the 33rd District from the Kent, SeaTac, and Des Moines area, and Representative Jerry Pollitt from the 46th LD. We thank our champions and friends and loyal members, supporters, and volunteers for your tireless efforts to bring publicly funded universal healthcare to our state, especially now in order to open up our economy again, but even more so after we have a vaccine against the coronavirus and need to make sure pre-existing conditions are covered. Universal healthcare is a requirement for getting everybody the healthcare they need when they need it, regardless of their employment status or economic circumstances. And speaking of economic circumstances, our annual meetings are traditionally the time when Healthcare for All Washington replenishes our funds for the coming year. Please help us to continue our effective work in Olympia by supporting the work of our part-time lobbyist and support staff in the coming legislative session. The donations link, look for it in the chat window, will be live throughout our program for you to access our secure payment site at any time. All contributions are gratefully appreciated and will be acknowledged. Thank you in advance for supporting our work.